Welcome to Chapter 15, Data Analysis and Reporting Based on Planning, Implementing, and Evaluating Health Promotion Programs by James Mackenzie, Brad Neger, and Rosemary Thackeray. This is the final chapter of the book, and it brings everything full circle. We've planned the program, implemented it, and evaluated it. Now we answer the ultimate question. What do the data say? Introduction to Data Analysis and Reporting. Data analysis gives meaning to the numbers and feedback collected during evaluation. First is, it helps determine whether the program worked. Second is, it aligns findings with stakeholder expectations and evaluation questions. Third is, it prepares information for decision makers in ways that are clear and useful. Health education specialists must know how to manage, analyze, interpret, and report data. This chapter covers all those steps. Data management. Data management organizes the information before analysis. First is code the responses. Second is clean the data, remove errors, and fix inconsistencies. Third is arrange the dataset for analysis. For quantitative data, assign numeric codes to responses that software like SPSS or R can process. For qualitative data, group responses into themes using codes and categories. Use a codebook to document how the data were collected and coded. Include question descriptions, response codes, variable labels, and analysis notes. Example: a CM prevention survey may assign codes for knowledge, behavior, and demographic questions. Data cleaning is crucial. Look for outliers, duplicates, or missing values. For instance, remove unrealistic responses like an age of 230 or blank fields. Data analysis. Once the data is ready, apply the correct statistical tests. Start by identifying your variables. Independent variables, the inputs like demographics or program exposure. Dependent variables, the outcomes like behavior change or knowledge gained. Descriptive versus inferential statistics. Descriptive statistics summarize your sample such as frequencies, averages, or ranges. Inferential statistics let you generalize findings to a larger population. B types of data analysis. There are 3 levels of analysis. First is univariate, 1 variable at a time. Second is bivariate, 2 variables, exploring relationships or group differences. Third is multivariate, 3 or more variables at once, identifying complex patterns. Choose your test based on the type of data, evaluation question, and audience. Refer to Table 15.1 for guidance on measurement levels and test selection. Also decide whether to use parametric or nonparametric tests. Parametric tests assume normal distribution and are used for interval or ratio scales. Nonparametric tests are used when assumptions aren't met, such as with nominal or ordinal data. See Table 15.2 for common equivalents. Univariate data analysis. Univariate analysis is descriptive. It looks at 1 variable at a time. Common statistics include measures of central tendency, mean the average, median the middle score, mode the most frequent response. Measures of variation, range the difference between highest and lowest values. Standard deviation, how spread out the values are. Variance, the average squared deviation from the mean. Example: COVID-19 temperature screenings used univariate data to identify patterns. Bivariate data analysis. Bivariate analysis compares 2 variables. It answers: is there a relationship or difference between them? Start with your hypothesis. Null hypothesis: there's no difference. Alternative hypothesis: there is a difference. Use statistical significance to determine whether the result is likely due to chance. Alpha levels like 0.05 define how confident you want to be. Beware of type 1 error false positive, rejecting a true null. Type 2 error false negative, failing to reject a false null. Box 15.5 explains this relationship well. Common bivariate test table 15.31. Chi-square compares 2 nominal or ordinal variables. 2 t-tests compare means between groups. Dependent t-test, same group at 2 time points. Independent t-test, 2 different groups. 3. ANOVA compares means across 3 or more groups. 4. Correlation measures strength and direction of association between variables from +1 to -1. Note: correlation does not imply causation. Example: correlation between seatbelt use and age. Multivariate data analysis. Multivariate analysis involves 3 or more variables. It's used to study complex relationships. Common methods include multiple regression predicts an outcome from several variables. Discriminant analysis classifies cases into groups. Factor analysis reduces large numbers of variables into themes. Example, predicting heart disease risk based on smoking, weight, and cholesterol. Case examples. Case 1 prenatal visits by age and education. Chi-square Case 2 sexual assault prevention knowledge before and after program. Dependent t-test. Case 3 hand hygiene compliance between groups. Independent t-test interpreting the data. Analysis gives numbers. Interpretation gives meaning. First is consider statistical significance. Was the result likely due to chance? Second is consider practical significance. Is the result meaningful to your stakeholders? Sometimes a result is statistically significant but not important. Other times, a meaningful change may not reach statistical significance. Involve stakeholders to make fair, relevant interpretations. Evaluation reporting. Reporting shares what you found and what it means. First is tailor your report to the audience. Second is be clear, accurate, and timely. Third is protect participant privacy and cultural sensitivity. There are many formats: executive summary, top-line summary, 3 5-page key findings. Full technical report box 15.6 outlines 5 essential sections of a formal report 1. Executive summary 2. Background and purpose 3. Evaluation methods 4. Results 5. Discussion and recommendations. Other formats include newsletters, press releases, conference posters, and one-on-one meetings. Presenting data visually. Visuals can turn numbers into understanding, but only if done well. First is choose the right chart type for your message. Bar charts for comparisons, pie charts for proportions, line graphs for trends. Use Evergreen and Emory's data visualization checklist box 15.7 to guide your visuals. Tips include write a clear summarizing title. Label directly on the graphic. Avoid legends. Order bars logically. Avoid grid lines and unnecessary borders. Use color intentionally and consider color blindness. Make visuals self-explanatory. Include extra graphs in the appendix, not in the main report. Provide your report in advance. Prepare for questions. Time your release strategically. Increasing utilization of results. What good is data if no one uses it? Stakeholders may ignore results due to timing, trust, or lack of relevance. Here's how to increase use. First is create your evaluation plan around stakeholder needs. Second is use valid, reliable methods. Third is interpret results fairly and clearly. Fourth is make realistic, actionable recommendations. Fifth is format the report to be engaging, visual, and jargon-free. Sixth is deliver it on time every time. To summarize chapter 15. First is manage your data well from coding to cleaning. Second is choose the right type of analysis, univariate, bivariate, or multivariate. Third is apply the appropriate statistical test, parametric or nonparametric. Fourth is interpret data both statistically and practically. Fifth is report clearly and visually when possible. Sixth is share your findings strategically. Seventh is increase the use of your results by focusing on stakeholder value. Final words, you've completed the journey. This concludes Planning, Implementing, and Evaluating Health Promotion Programs, 8th edition. Across 15 chapters, you've explored every stage of building and evaluating health programs. You now have the tools to lead with clarity, evidence, and purpose. Thank you for following along. Keep promoting health, keep measuring impact, and keep growing as a public health leader.